Good evening, Door County and Sturgeon Bay. I don't know why I always mess that up when I start. It's like I can't ever decide if I want to say Sturgeon Bay or Door County. But good evening to everyone. Thank you so much for joining us on this, our 11th weekly Facebook Live, talking about COVID-19. Looking forward to your questions once again. There's been great questions every week, and we're hoping that you're finding these helpful. Been kind of a rough weather day. You know, I want to start out by giving a shout out to our nurses that are over at our testing site. They were out we had quite a number of people that called in needing to be tested, and they were coming out in the driving rain and wind, and they did just an amazing job. And actually, we talked to them and said, would you rather not do this? And they were like, nope, we're fine. A little bit of rain isn't going to hurt anybody. So really want to thank them for their efforts. So as always, I'm joined by Sue from Public Health. Thank you so much for being here again.
Thank you, guys.
You've been a little busy.
Just a little.
Just a little.
You too.
Just a little. Yeah. So I think what we'll do is we'll do what we always do each week, and we'll start out, Sue, with our local update.
Sure. I'll give you the numbers. So as of today, we've had 33 positive COVID cases in Door County residents. Of that, 14 have recovered. There's been 3 deaths. Altogether, since the beginning of this, 892 tests have been done. 605 of those were negative, and as of today, there are 253 tests pending. So Dr. Heise wasn't kidding when he said the testing center is busy.
Yes.
They've really stepped it up, and that is great for our community and very helpful for our public health follow-up. I hope all 253 results don't come in on the same day.
Me too.
Unless they're all negative. That would be great. That would be great. Yeah, we can hope for that. So that's about all I have for the update at present.
Yeah, I think you covered all of that from our end. I think the numbers are pretty much the same. So far we've tested 820 here. So that's a fairly decent number, I would say. So we're going to jump right into questions. There's a couple things we'll talk about. I think I want to talk a little bit more about antibody testing, and because there's a lot of continued questions about that, and also turnaround time for testing. So I think I'll start with that. I know, turnaround time for tests, when people come and they get tested at the dental clinic, at the tent as we call it, we try and give our best estimate of what the turnaround time will be, and it all depends on the lab where the test is being run, and and what they tell us is their turnaround time. And it had been the state lab, which requires certain criteria. The state lab had been about 24 or 36 hours, still is, but most of us that would go there to be tested don't meet the state lab criteria, at least as of today. The other labs are commercial labs, and they had been about 3 days to 5 days, and now there's a lot more testing going on, I think pretty much everywhere. I think much more widespread testing is occurring, and the results are now back out to 5 to 7 days, which I know for many is very frustrating. And so we're going to be just sort of editing our script, if you will, just to let people know that it might be up to a week. But we as soon as that result is back, we get those results out. If it's a test that I ordered, which I order most of them, I call right away. And if it's a negative test, the nurses at the testing center call. So I understand there might be some frustration with that, but we're all doing the best we can with what's in front of us. And even labs that say, hey, we had one lab out of the Madison area called Exact Sciences. They were very firm at 48 hours, and then it takes an additional day to get it to them, so 72 hours. Well, they now are overwhelmed, and so they're out to about 5-ish days or so. So, which, that has a lot to do with planning on our end too. For people that are coming in for elective surgeries, we test those folks before, and that's a tough thing.
So maybe we should talk about the idea of community testing while
Yeah.
we're on that topic. So I'm sure everybody's heard about Brown County has a large community testing site, and that was really in response to the outbreaks they had there. And that is facilitated by the state and the National Guard. And Door County Emergency Management and Door County Public Health together can request something like that here. And we have been communicating with the state about that. That's not something that pops up overnight, but it's a possibility for us, especially if our local resources get overwhelmed. And it's really meant to be a stopgap to increase our testing overall, our testing capacities. So along with that, we would look to other community providers or Door County Medical Center to enhance what they're already doing as far as maybe more locations. And personally, I would love to see some testing done in Northern Door, I think, that, especially with the summer season coming up. So we're reaching out to community providers, other healthcare providers regarding that, and working on that along with consideration with the state for a community testing site. And that would be temporary. That would be 1 or 2 days during a week. If we were lucky, we could get them to come back the following week or perhaps 2 weeks later to do another round of testing for community members. And perhaps we'd, in my mind, what we would do is prioritize, like perhaps day one it would be healthcare providers, including maybe staff of assisted livings or other facilities like that, and first responder type people, law enforcement, any other healthcare providers. I'm not coming up with anybody else. I'm sure I'm forgetting some group. But then the next day would be widespread community testing, anybody who would want it. The state doesn't want necessarily people who without symptoms to be tested, yet they are saying that if there are groups such as staff from assisted living or other staff groups or populations of concern that are prioritized by public health, such as we've done if we've had an outbreak, we'll test asymptomatic people, have them tested.
And I just was looking at the CDC recommendations today, which I think were new, or at least an update. And I had been, I've been of the mind that if we have the capacity to do it, especially if the National Guard came up and did community-wide testing, I'm of the mind that anyone that wants to get tested should be able to get tested. The CDC and the Department of Health Services of the state continues to recommend people with symptoms, which makes sense. There's still a lot of debate as to whether or not it makes sense to test early. It's kind of one of those things where I'm never sure where to fall on that, because on the one hand, there's a lot of data that suggests that there's a fair amount of viral shedding that can happen just a day or two before symptoms begin, and so you don't really know, so maybe testing is a good idea. But then there's other data that suggests that testing in the asymptomatic phase is it doesn't yield appropriate results. So it's hard to know what's right. And so when it comes to like anything with a limited resource, you have to sort of come down on the best judgment you can. So CDC and DHS continues to say to wait till someone is symptomatic. So we're kind of doing that at this point. We've already got a lot of questions. I'm going to see if we can encompass a bunch so I don't miss any. Thank you, by the way, for all the questions. It's if I miss yours, and if we miss them, it's not our intent to miss them. It's just that the way that the Facebook tends to work as far as their question scrolling. I wanted to go back because there's some good questions that I think others. Example of which is like husband's a musician being asked to play at small weddings in June and July. Do you think it's safe? I think it's going to be into the summer. I think that what the common thread throughout the summer for the foreseeable future is going to be social distancing and wear a mask. And I think if we all do that, I know that's not exactly romantic at a wedding, but if we all do that, wash our hands frequently after we touch different surfaces, I think it's going to be fine. I think that's sort of the basis behind being able to get back out there and get some businesses back open. So, it's always, for me, just as a personal opinion part of this that I'll say is, it's irritating, I guess, maybe that's a harsh word, but it's disappointing to see when the minute the governor's order goes away, people run to bars without masks on and start to drink. And I'm thinking, well, that doesn't to me make a whole lot of sense. I mean, if at the very least, if you want to go to a bar, at the very least wear a mask, because then at least you're helping yourself a little bit. Because what we really don't want, what I don't want, is I don't want to see another spike in testing that's going to scare the government into once again trying to clamp everything down. I think if we can be smart about this, we can open up wisely and we can do well and not have to have the government step in for us. Go ahead, Sue.
Well, you're reminding me about the overturning of the Safer at Home by the Supreme Court. And so it really is going to go back to a grassroots effort, which it is the most effective all along, and that's each one of us is responsible to do the things Dr. Heise just mentioned: social distance, wear a mask when you're out in public, practice good hand hygiene, and if you're vulnerable, take further precautions, stay home more, only go out when you need to. Think about where you're going and don't go to somewhere if they're not practicing the safest guidelines.
Yeah. One person asked here, does targeting Northern Door mean positives are present outside Surgeon Bay Village? No, it just means that
No.
people are, it's a little bit more rural up there, and coming down, our testing site is obviously here across the street at the hospital, and so it'd be nice to make it a little more convenient for people, that's all. So it doesn't mean that there's nothing else to be read into that. Let's see. Sue, this is a good question. For those employees at the 2 restaurants that had to close, should they be quarantined yet for 14 days? How would you answer that?
Okay. So first of all, the restaurants didn't have to close. Both of them chose to close voluntarily. That wasn't any requirement from public health. Second of all, each employee is a little different individual consideration. And in general, if someone's been in close contact with an active positive COVID case, then they are to quarantine for at least 14 days. If they develop symptoms within there, then they need to be tested. The 14 days is the longest incubation period, at least that's what we believe it to be now.
Mm-hmm.
I think that answers it.
Yeah. And I'm just going to, someone asked, what about the status of Bay Ship? And I think there's a lot of talk about that. Why haven't they come forward? I'm not sure there's anything to come forward about. I mean, I'm not aware of there being a whole lot of cases at Bay Ship, and we do all the testing in town. So and that's honest. That's the honest truth. So I really don't. I think there's a lot of. I think people are very prone to listen to rumors these days, and I tend to consider myself a pretty straight shooter. So even though I can't, there's confidential stuff I can't talk about, I still could say if there were a bunch of cases at Bay Ship, and to my knowledge there aren't. And that the key is to my knowledge, and as I say, I see the list of all the people that come through and test, and so I'm not aware that that's a thing. So,
and I certainly agree.
Yeah.
People seem to go off of rumors, and that's not really a good idea.
It gets you upset for no reason,
It does, and there's a big fear factor with COVID, and that's understandable. The other thing I want to really clearly say is if Bay Ship or if there's any industry or business or situation with COVID cases that the public needs to be aware of to be safe, we will tell you.
Yeah.
If there is a reason for the public to know about COVID cases to remain safe, we will tell you.
And Sue and I, we kind of get a kick out of this concept of we're sitting back kind of, we have secrets we're not telling people. I mean, it just isn't the case. And so, but this is a time where people are really nervous about what's going on. And I certainly, cut a lot of slack because of that, because it's tough. Someone had asked, and that's what I was looking for a while ago, someone was asking, the DCMC is requiring COVID testing prior to procedures or surgeries. Why and how long until that ends? Yes, we are requiring a COVID test prior to surgery. And the reason is because we want to know if you have it or not before you have surgery. Because the surgeries that we're doing, any admission is tested for COVID, so we know we know a person's status before they end up in our hospital. If it's an elective surgery, one that doesn't necessarily have to be done, it's not a life or limb thing, and if someone came back positive for COVID, we would wait until they had recovered. I mean, whether they were symptomatic or not, we'd wait till they recovered, because that only makes sense in an elective surgery. We're not alone in that. I'm not aware of I'm aware of very few facilities nationwide that are not doing testing prior to a procedure. How long will that last? That's a really good question. I don't have an answer for you right now. I think until we have a better handle, so to speak, on COVID and where it's going and what's going to happen, we'll probably keep testing until we know. I think a lot of the stuff we're seeing now, I think it's pretty safe to say we're going to see, as far as testing, as far as masking, it seems pretty safe to say we're going to be seeing that into the fall, at the very least, wouldn't you say?
That's my feeling.
Yeah.
But, and you hit on it, the hardest part about all this is we don't know when or how it's going to end. I mean, how soon. Somebody said to me last week, this is like a marathon where they keep moving the finish line. It feels exactly like that to me.
And one person commented, again, just for transparency, the reason why base ship keeps coming up is because they have been very slow in installing basic procedures of sanitation, and because some employees have behaved recklessly. Well, I could say that about a lot of people in this community. So I think if I've learned nothing else living I mean, I think anywhere really, people have very specific opinions and very specific agendas, and they move forward with that. And that's, so let's see. I'm being told Base Ship has 4 cases. It's on the Finkenterry website. They most likely have been tested in Green Bay, not here. Well, you would know, because if they live in Door County, it goes on Door County's rolls, but it's possible, absolutely possible. Let's see. What else? I wanted to talk about, and I hope this isn't over redundant, but one of the things is, once again, the antibody testing. There's some questions about antibodies, antibody testing, and will insurance cover it? It's hard to say for sure. I do know that Purveya 360, which is has a pretty wide reach around here as an insurance company, they do cover antibody testing. Otherwise, you can always check with your insurance company and find out if they test it. I know that the tests it costs about $160 if you have to pay out of pocket. So you'll want to know that. But I just want to point out again, for people that want antibody testing, the key is it'll tell you whether or not you've been exposed to COVID, whether or not you've had it. So if you have antibodies to something, then you'll know that if you have antibodies, you'll know that you were exposed to it and you've had it. Otherwise, it doesn't tell you if you're immune. It doesn't tell you if you have had it and are done. It doesn't mean you should stop masking. It doesn't mean any of those things. And so really at this point, it gives you one bit of information, which is you've had it. And that's about all. So it's a good test from an epidemiologic perspective, because if you get it, we can say, hey, you've gotten it, and we can count those. They're not counted as a positive test, though, because they are not, by the nature of the test, diagnostic of COVID, which I know sounds a little strange, because on the one hand I'm saying it says you've had it, but on the other hand it's not diagnostic of it. The diagnostic test is the RNA, the PCR, the amplification test. Hope that makes some sense. Sometimes I wonder if anything I'm saying these days makes sense because of what changes all the time.
Things do seem to change overnight, or even faster.
Yeah, exactly. All right, let me see what else we have. Are we still under the Badger bounce back? Can you speak to that?
So the Badger bounce back is still being documented on the state website, and they're still keeping track of the scoreboard. I think as of this morning, we were half and half. There was some reds and greens on there. And if you don't know what I'm talking about, there's 5 or 6 metrics. I always forget if it's 5 or 6. One is that there's a downward trajectory for 14 days in the number of tests that are positive. So that's, if it's green, that's really good. That means we've had that. If it's red, we haven't had that. So there's those metrics, and it's still being looked at. What isn't happening is the state plan that guides regulations, because the state no longer has the regulations as of the overturning of the Supreme Court overturning the Safer at Home rules. So it's still being looked at, but there's no rules around that. So as you probably are aware, last Thursday, Door County Public Health issued a health order to continue the Safer at Home for the time being. And that was really important to give us a little time to plan and for everybody to just plan the next move so we can be safe and reopen businesses safely, and for the community to know how this is going to work. So in the next day or two, we'll be coming out with our next steps, which is not going to be another order. It's not going to be any ordinance or regulation or anything enforceable. It's going to be guidance and recommendations. Mm-hmm. So in other words, we're relying on, as I said earlier, the grassroots effort for everyone to do their part. It's really important if we want to stay healthy and have our community be thriving and be able to welcome visitors and have our businesses thrive, that we all take care of ourselves and social distance and all those things that I'm not going to say again. But anyway, the guidance that's going to come out from public health is all of those things, and mostly it's referencing for businesses the Wisconsin Economic Development Corporation, the WEDC guidelines. So if you're a business, go ahead and look those up. I'm sure you have. We've been publicizing that, and so those are the next steps.
Yeah. And Mark has a question that's really good, another good one. Has the number of hospitalizations risen with the rise in positive tests? And the great news behind that is no, they have not. As a matter of fact, we've had three total hospitalizations relative to COVID, that have had COVID. Unfortunately, all those three were ones that have died as a result of COVID. We have not had a positive, a hospitalized COVID case for, I want to say, going on 3 weeks. So that's a really good thing. So the people that I speak to, when I give them their results, I'm always really pleased when they, the conversation usually goes something like, "Hi, this is Dr. Heise calling from the hospital. Just wanted to call you on your COVID test. It turns out it's positive." And they say, "Really? Wow." And I say, "How are you feeling?" "I'm feeling fine." Or they'll say, the other one that I've heard a fair amount is people will say, "Boy, I felt miserable last week. It was just terrible. I had body aches and I had no energy and was tired." Those two things seem to be really biggies, just no energy at all and body aches, and some people talk about the cough and the shortness of breath. But so that I look at as really good news, is that the disease we're seeing is not severe, and that's good. And just as I don't know, for what it's worth, my position on as far as opening back up is I want us to open back up. I think we need to open back up. I just think we have to be smart about it. That's all. I mean, I think we can do both. I really do. It kills me to see some of these businesses really struggling, and that's it's a tough nut. And none of us ever thought this sort of thing would happen. But I will never say we shouldn't open back up. We just got to be smart about it. And I think as time goes on, we'll learn more. Let's see. Who should get an antibody test? Really, there's no should with antibody testing at this point, other than some people that there are some that are very interested in being able to donate plasma for convalescent plasma, and that would require that you've had COVID, and if you tested and the antibody was positive, then you potentially could be a plasma donor for convalescent plasma. But really, aside from that, there's no should at this point. You can be, and it perhaps will give you some peace of mind. I think what we're seeing a lot of is a lot of people are saying, "You know what, I felt just awful the beginning of March, and I'll bet that was COVID. I wonder if I should get tested." Mm-hmm. you know, and contact your primary clinician's office, you know, if that's what you'd like to do.
So I had Sue call today asking, not me, a different Sue, asking a question, and she said she remembered her doctor saying nothing can be done for a virus. You just have to wait it out and just let it run its course. So her question is, how can there be a vaccine then? How do we make a vaccine? You want to answer that?
Yeah, that's a good question, and there's a lot of talk about, you know, 18 to 20, or 12 to 18 months to get a vaccine, and a little that's kind of crazy talk. I mean, it takes a long time to get a vaccine going. I hope I'm wrong, and I hope that because of the urgency of the situation that we can do what we haven't done before. But any virus, I mean, any virus that tends to be relatively stable and doesn't change itself in multiple ways, doesn't mutate, things like that, you hope, at least in theory, you could generate a vaccine. All a vaccine basically is vaccine is either, they call it live attenuated, which means it's live virus, but it's weakened so much that it can't make you sick, but it's enough to make your body produce antibodies to it. Or it can be dead virus, which is you take you manage, or you manufacture in some way, usually in animals, the COVID-19 virus. It's a dead virus. You can then inject that into people safely, and the body would generate antibodies to that dead virus. So you absolutely can do it. Is it a given that we can do a vaccine? No, it's not. In fact, back in the early days of HIV, the discussion was, and the conversation was continually, we're going for a vaccine. Do we have a vaccine for HIV? No, unfortunately not. So it's not a given that that it necessarily will work. So that's kind of what we're waiting for. You know, for me, I think it will be even better. I don't know if we're anywhere close to it. What will be even better is to come up with an antiviral medication that would kill off the virus. So if you have a way that you can treat something, that if anyone gets it, you can give them an antiviral and it will either stop it in its tracks or severely reduce the severity, you're better off. Look at influenza. Influenza is a virus, and you know it does change itself. There's all kinds of variations of the influenza vaccination. That's why we have a flu shot every year, because the virologists and the smart people in medicine are looking to see what do they think is the most likely strains that are going to be predominant this year, and they will create a vaccine for those strains. And so what we see is, generally speaking, a large percentage of people that are vaccinated don't get influenza. No vaccine's perfect, and so we still have people that have been vaccinated that will still get influenza, but generally speaking, if they've been vaccinated and they get influenza, it's not as severe an illness as if you hadn't been vaccinated at all. What do you think? That answer the question?
Yes, and there's an antiviral for influenza too.
There is.
Yeah.
That's true. Matter of fact, there's some talk about there's one out in the market right now it's in the marketplace that they're using it for compassionate use, and they're trying remdesivir is what it's called, and it basically is a sister drug to Tamiflu. Not the same, but it's a sister drug. It's in that same antiviral class, and so the hope is that might be promising. So far it sounds at best, from what I'm understanding. Let's see. Governor Evers ordered that all nursing homes and CBRFs, community-based residential facilities, to be tested for COVID-19. Do you know when local nursing homes will start to be tested? I can speak to our skilled nursing facility at the hospital. We have the residents, I believe, have been tested. The employees have been tested as well. We're waiting on those results. I don't know about Sturgeon Bay Health Services. I don't know about Sandia Village at this point.
I think they're both due to be tested this week,
Okay.
if I have the schedule correct. But CBRFs are not included in that because they're not skilled nursing facilities. The governor in that order, that effort by DHS just involves skilled nursing facilities, nursing homes. Yeah.
Okay. I'm sorry for looking away. I'm also the hospitalist in the hospital, so I'm having to keep track of that as well.
I hope they don't call you right now.
Well, someone just did. It's okay. Spike in testing due to feeling ill or just exposed. That's a good question. I think part of the spike in testing is as a result of what we already know to be true, that the Culver's positives. We've tested all the Culver's folks, tested all the McDonald's folks, and we've also broadened it out to where we've said, look, if you have any symptoms at all, you're welcome to come in and get tested. That's kind of our way of or maybe it's more my way, because I'm kind of pushing it. It's kind of my way of saying, look, we don't want to do asymptomatic, but if you've got a runny nose and it just feels wrong to you, get tested. We're here, we can test you. And I don't say that because we're making any money off this, because we're not. I mean, contrary to what the rumors that are out there, we're not making any money on this really at all. So it has more to do with testing, knowing more what's in our community. It helps us more to make better decisions if we know that 30% of the population has COVID as opposed to 3% of the population. It allows us to make some better decisions. So that's why I think there's more testing. Is we basically said, come on out and we'll test you if you have symptoms. But again, as I mentioned before, we're not seeing an increase in hospitalizations. We're not seeing an increase in emergency room visits related to COVID at all. It's more people that are getting tested and they're able to stay at home and rest and get better on their own, which is really good news. It would feel better if more people would wear masks. Can you reiterate why it's important to protect others? I'm going to throw that to you.
Oh, well, you're so good at answering it. But it is really important, and I feel the same way. It would feel much better. What it does is, if I have COVID and I don't know it, and so I'm still leaving the house, if I'm sick, I'm staying home, right? And then I'm calling Dr. Heise to say, can I get tested? Or the hotline. Don't call him personally. But if I'm feeling well and I go out in public, I might have COVID and not know it yet. So it's really important for all of us to wear masks to protect everybody else. And if you feel silly, well, just remember that you're doing a great service to the rest of the community, especially the vulnerable populations. So that fabric mask isn't perhaps going to protect me much at all from any COVID germs coming at me. I guess it could somewhat. It's a little bit of a barrier, but that's really not the purpose of the fabric mask.
And really, it also is. It helps you to remember a few things. It helps you to remember things like covering your cough. It helps you to avoid touching your nose and mouth because the mask is on. I mean, unless you on your own go underneath the mask and scratch your nose and mouth, but it kind of so it does help. And I've gone back and forth with masks, but right now we really have seen dividends being paid by people wearing masks. And I have seen it personally when some of the positives that we've had they been wearing masks, they wouldn't have gotten it. Just because, again, the barrier that's there, just the spit barrier for no other reason. And that's also why wearing a mask, covering your nose and mouth is important. If you just cover your mouth, you still can get it. If someone is talking to you without a mask on and you have just your mouth covered and not your nose, that's where you're going to get infected. In fact, this is the greatest area of infectivity, even more than the mouth. So you need to cover both. So that's kind of why for masks. I think it will be interesting as the summer goes on because, one of the things I always think about is people that they're waiting for Disney World to open back up, and I'm thinking about being in Florida in the sweltering heat in Florida wearing a mask. That probably is not something I'd want to do, even though I love Disney World, but that'll be interesting.
Dr. Heise made a Facebook video, and it's on our public health Facebook page, and I'm pretty sure it's got to be on the Door County Medical Center Facebook page about masks. And it's educational and it's humorous.
Tries to be. There's a couple comments here that I'll make reference to. Bay Ship does have 4 confirmed cases, and a large number of their employees drive in daily from Brown and Kewaunee counties. That's absolutely fair. Will Door County open up the testing to all county residents, similar to what they're doing in Brown County? We talked about that at the beginning of the Facebook Live, and I think if we had the ability to do that, we would do it. In fact, I don't want to speak for Sue, but I know Sue and the EOC, the Emergency Operations Command folks, have put out a request. Is that accurate? Because what's happening in Brown County is the National Guard has come up, and they are taking care of, basically a battalion comes up. They set up a tent, they mass test people, and they take care of calling the people with results and things like that. So, I would love for that to happen up here. Whether we rise to the level of importance that would allow that, we're not sure yet. So, yeah. And I think, that's a really good point. I appreciate Chuck bringing that up, that people drive up from Brown and Kewaunee counties, because those numbers are, in fact, recorded in the Brown County and the Kewaunee County. Where you live is where it's recorded. So even if you had it, and the fact that it's in Brown County and Kewaunee County, their public health departments do the same thing that Sue and our departments do here, which is, you're positive, you need to quarantine for 14 days, right?
Right, isolate. Right.
Yeah, isolate. So it's not that, oh, they were tested down there and they're still coming to work. So, and I think there is an open invitation for any business and any person that has symptoms. If you feel crummy, or if you're not sure, if you've been exposed to someone that you're not sure about, come and get tested. We really would like to know if those symptoms are related to COVID or not. We've got, can you please address the opening of salons? I'm smiling because my hair is awful and it's time to get it cut. Do you want to talk about that?
Sure, they will be allowed to open and follow, like I mentioned earlier, the WEDC, Wisconsin Economic Development Corporation guidelines. And I haven't read all the guidelines word for word because there's a whole lot of them, but I know that for salons it's going to involve social distancing, and I think they're probably going to be putting up some plexiglass partitions or maybe working every other station, that kind of thing. It's going to be a challenge for them.
Yeah, these are not easy questions to always answer, and they're not easy logistics to figure out.
Right.
I've read that it's not always good to never leave your house, but that you should go out to gain some immunity. Is there truth to that? Sure, I think there's always some truth to that. I mean, there's the whole herd immunity concept. The problem with a virus that attacks people differently and can kill you is that, if you subscribe to the herd immunity, then someone's got to take one for the team, more than one. But I think the bigger point to Mimi's question is, it's not always good to never leave your house. I think you should absolutely leave your house. I think that getting out and about, taking a walk, going to a park and walking, I think that's absolutely what you should do. Matter of fact, there's one of the things that people have asked, and there seems to be some indications pointing in the right direction, that people will say, well, come summertime, will this virus wane or get better? And what we're seeing is, it seems like this virus does not like UV light, it does not like heat, it does not like humidity. So if you look at some of the southern states, Florida had the predicted number of deaths was rather high. I can't quote that number, but the actual number of deaths and cases is significantly lower. And if you look broadly, that seems to be the case. And so I think we're kind of thinking, and we're really hoping, that over the summer this does wane, just like seasonal influenza does. Of course, the concern then is, when it gets cold again, will we have a resurgence of this if we don't have some kind of an antiviral or some kind of an effective vaccine, which I don't expect we'll have. So those are open questions, but I'm more convinced now with some of the things I've read and seen that the virus doesn't like heat, doesn't like sun, doesn't like humidity, and that may be a help for all of us.
So no one can predict the future, but I just have to ask what your opinion is on that resurgence in the fall.
Yeah, I don't know what to think about that. I mean, I think, the way that I tend to deny bad stuff, and so it's sort of like, I don't want to believe that it might that we might have a resurgence in the fall. I think, what'll be interesting, as I'm touching my face because I have an itch, what'll be interesting is if what I just said is true, that as it gets warmer, that the virus will be less. We really won't know if opening things back up, and for people that don't want to wear a mask, will that cause an uptick in cases? Because the uptick in cases may be negated by the warmth and the improvement in weather and the seasonal ebb of it. So we may not know if that in fact causes an increased number of cases. We may be surprised in the fall. Don't really know. So I find myself thinking, I learn something new every other day, every week in this, and so part of me is, that's why I say let's open back up, let's use masks and be smart about it, and let's see what happens. I think I've seen a lot of comments on here about what about people that refuse to wear masks, and what do we do about that? In the end, people are going to do what people are going to do, and we can do the best we can to get the message out that this seems to be the best way to combat spreading this virus is by wearing masks in public. No one is saying you have to wear masks when you're walking down a trail at a park, or when you're sitting at home in your living room, or for heaven's sake, you don't have to wear a mask alone in a car. But that's the way we're gonna keep this from going. And I think if people just insist to not wear it, I think that's where we might, if we're going to have an uptick, that might be where it is. Those folks themselves may become ill if they're exposed. So we'll just have to see. We're kind of closing in on the end of this. Let me see what else. I know I'm missing a lot of your questions, and I apologize. I'm trying to fly through and see. Someone asked a question about pets. Can you pet sit or something? I don't know that much about pets. My understanding is that dogs have not really been showing COVID. I think some cats and ferrets have, I believe, but honestly, I have a golden retriever, and I spend zero time worrying about whether my pet would get it from me. I really do, because I'm more worried about my wife and my son. But it's a good question. Does a face shield help protect you? It does. You don't need a face shield if everyone's wearing a mask, because again, we wear a face shield in the hospital. We wear goggles, which I've got right here. This is my armor. I wear that because in the hospital we don't have patients wearing masks in the rooms. That would be cruel and unusual punishment, because they're in the hospital, they're sick. The last thing you want is to wear a mask. So that's why I wear eye protection. If people are wearing masks, it's okay. Someone said, you look a lot sillier if you don't wear a mask now. That may be true. I heard a new phrase, which is called virtue signaling, which is people wear masks, and they're virtue signaling by wearing masks and saying, hey, look, see, I'm better because I wear a mask. And I thought that was funny. I don't think that's true at all. I think it's just, I just feel like those of us that, I think most of us care about our fellow man. I think we're blessed to live in an area where we care about our neighbors, we care about our friends and family, and so we want to do what we can to prevent illness and death. We've got about 2 minutes to go. Let me see if I can find any more exciting questions.
So while you're looking, this conversation is reminding me about the partnership for infection prevention between Door County Medical Center and Door County Public Health. We came up with some really basic guidelines that businesses can adopt and perhaps put in their window, or put the logo that's been developed in their window to let people know that they care about the community, and they care about their patrons, and they want to do the right thing to prevent infection, spread of infection rather, and including asking their customers to wear face masks.
Mm-hmm. So. Here's a really good question. There were last Monday there were 22 cases. Now there are 33 cases. Does this 50% increase in 1 week constitute a surge? It doesn't, and the reason is this: we're casting a wider net. So if I have a net this big and I throw it into the lake, I'm going to catch 1 or 2 fish. If I catch one that's 30 feet by 30 feet, I'm going to catch that much more fish. And so I think that's why. I don't look at this as a surge at all. a surge for us would be, and you can speak from the public health perspective, a surge for us would be more hospitalizations, more presentations of illness and things like that, which we're not seeing. Another person, I think this will be the last question we have time for, that I liked was, we've seen the number of deaths, but what about people that have survived, and what about, is there damage to organs? Is there ongoing problems as they go on after having suffered COVID? And I think that's an excellent question. I think there's a lot we don't know. You know, as I said, in our 3 cases, very unfortunately, the sickest of the sick did not survive COVID. I think had they survived, there would probably have been a lot of issues. So there's this virus, when it's at its worst, does amazingly terrible things to the body. It affects the lining of blood vessels. They're called endothelium. It affects the lining of blood vessels. It affects the alveoli of the lungs, which are the little balloons that help oxygen exchange. It affects those directly. There's a lot of things it does at its worst. So yeah, so I do think that we'll know more as time goes on. Well, I think it's about all the time we have. Any last minute words of wisdom?
I don't know if it's words of wisdom, but I want to tell everybody to look for some information coming out from public health very soon, hopefully tomorrow or the next day, press release and recommendations for what the community, we're going to ask the community to do.
Great. And next week Monday is Memorial Day, so we're not going to have a Facebook Live next week Monday, but we'll return the week after and look forward to that. Just want to thank you all so much again for participating and for asking really good questions. I've really come to enjoy sort of the conversation that we have, Sue and I, with the rest of you. I hope that this is helpful. And in the meantime, stay well and stay safe.